we are primary care. So when it comes to anybody accessing our service, we would be kind of the first step, early intervention. And our service operates a step care model. So we provide step 2 and step 3, and then we would refer on for secondary care, which would be step 4 and above. GPs can refer into our service, so they would be the first point of access for some people. Within our service, we have psychological wellbeing practitioners at step 2, and then different modalities at step 3 for common mental health problems. Within the Wakefield district, we are the talking therapy service, so we're NHS funded. Every area across the country has a talking therapy service. It used to be known as improving access to psychological therapies, but now nationally known as talking therapies. We will link in with other professionals as well for further support if we feel as though people need to be signposted on. I think it's important for professionals to understand the referral process so they can set expectations with clients. It can be quite difficult for somebody to step forward and acknowledge that they need support for the mental health. So to understand what the period of time might be for waiting for any kind of contact from our service, be it for the assessment or be it for treatment going forward, those expectations can be set quite early on from a healthcare professional. If we see a client and we recognise that they're not suitable for ourselves, then we will communicate that to them. It's normally something that we determine from the assessment, and then we'll be signposted elsewhere or a referral will be made on elsewhere. But ideally, we want to get across our suitability criteria and make sure that people come to us at the right time and that there's not so many steps in their journey for getting the right support for their mental health. The client would be informed that we're not suitable for them. I think it's better to let them know that we're not suitable for them, not that they're not suitable for us. And then they'd be referred on or signposted elsewhere. We will also speak to professionals to encourage them to know a little bit more about the service and know when is the right time to refer to our service, because sometimes it can be a little bit confusing to find the right support for somebody's mental health. So when it comes to the mental health difficulties that we might support with anxiety, it is an umbrella term. So we might be looking at things like phobias, post-traumatic stress disorder, obsessive compulsive disorder, panic, body dysmorphic disorder. Again, everybody's experience is different. So it's not just everybody's anxiety is the same. We'll treat what's there, what's presented to us, and that individual's experience that they talk about as well. I think what some people forget about sometimes is sleep can be quite heavily impacted by mental health difficulties as well. Within each thing that's just been mentioned there, with depression and anxiety, you have different types. So it's not just as simple as one person's anxiety is the same as everybody else's. We're not trying to diagnose, we're not a diagnosis service, but we will treat the person for what's presented with us at that point in time. So our therapists will have additional training for long-term health conditions, and that can be anything from diagnosis of diabetes, it could be cardiovascular disease, it might be some form of respiratory condition, and they'll work with that individual on a case-by-case basis to see what's suitable to them. It may be that they're coming to terms with that recent diagnosis and need further support, but they'll work alongside other health professionals to make sure that they get the best support possible. With talking therapies, we try to make sure we speak to everybody, try to make sure we reach out to anybody in the Wakefield district. You never know when you might have a difficulty with your mental health and you need to come forward and find support. Make sure you find that support early on and you can book in for an assessment quite early with ourselves. If somebody notices that there's a change in somebody's behaviour, if somebody is struggling with their mental health and looking for support early on, and it's quite new to them, then we're definitely a service that they probably want to consider speaking to. And through that assessment and speaking to a therapist, then we'll be able to identify what we might be able to work with them on and what's the most beneficial therapeutic intervention. If somebody is under the age of 16, we wouldn't be the right service for them. And if somebody isn't registered with Wakefield District GP, they'd have to kind of look to see if there's a service that is more suited to them based on their location. But also, if they're presenting in a bit of a different way and they're potentially in a crisis situation where there might be an imminent risk to themselves or to other people, at that point we wouldn't be suitable for that person, and we would refer on and make an immediate referral if they were presented to us. We would also sometimes see people that aren't suitable for us if they have presentations that look as though they're more of a secondary care level. Again, we're a primary care service, so if they maybe have some form of psychosis, if they have borderline personality disorder, if they have an eating disorder, then we would recommend a secondary care service for that, and hopefully a direct referral to secondary care can be made. If it's known that a client may have difficulties with substance use and that is a primary focus for them, then we would recommend referring to Inspire and Recovery rather than ourselves. It may be that they have difficulties attending appointments on a regular basis and maintaining that relationship with a therapist. Therefore, if that was to happen, they're going to struggle to recover and benefit from talking therapies at that point. When a referral is made to our service and it comes through a professional referral route, what we'll try to do is speak to those professionals and make sure that they're informed about what we do at Turning Point Talking Therapies and that they know that they're making the right decision when they make a referral to our service as well. We'll also signpost to a client to make sure that they get to the right place and inform them of other options available to them. We have great links within the district of other services that are available, and we always try to stay on top of that and communicate effectively with them. To access our service, historically, GPs would refer into the service and other healthcare professionals as well. Now we're encouraging a broader range of health and social care professionals to refer into the service, but also a self-referral can be made. So this is mainly done through the website. There are referral links on the website for people to go through the form, but also it can be done over the phone as well. So if somebody needs to make a self-referral, they can pick up the phone and give one of our client advisors a call. Additionally, when we're out and about in the community, we're at different events, we also welcome community referrals as well. So if we find that we're having a conversation with somebody and they're talking about the difficulties, we would welcome them to make a referral at that point because we're capturing that conversation there and then. We don't want people to go away and overthink it and then talk themselves out of making that first important step. For a professional referral, that can be done over the website or over the phone. If it's done over the phone, then a client advisor will go through that professional referral with them. The client doesn't need to be contacted at that point. It's not until they're booked in for an assessment that the client will be contacted and they'll go through that stage with them. So once we receive a referral, whether it's over the phone or via the website, that's going to be processed and then that person will get booked in for an assessment based on their availability. Once a decision's made internally with case management about what therapy options are available to that person, that client, then they'll be contacted and that'll be discussed, and then we've got a therapeutic arrangement made at that point. If we receive a referral for a client and we believe that it's not suitable for us, but it's come from another healthcare provider or another healthcare team, then there are some times cases where that will go to a multidisciplinary team meeting and it's discussed amongst healthcare professionals then at that point to see what is the best option for that person. So within the district, it's not just then at that stage Turning Point Talking Therapies that makes the decision, it's other healthcare providers and other teams that get involved to make sure that person is receiving the best care. If an organisation or a group of professionals needs more information on our service, we can put on an information session for them where we'll visit them, or we can put on a team session to talk about the service in a little bit more detail. for them to understand that they're making the right choice when it comes to referrals. We can also provide information via workshops and do some psychoeducation on a variety of different topics around anxiety and low mood, sleep problems. It could be to do with the menopause, or it might be to do with emotional eating. We have a long list of different workshops that people can benefit from, just to find out a little bit more about the service and what to expect when it comes to speaking to a therapist. If there's any uncertainty about whether a client might be suitable for our service or not, then we would encourage you to get in touch and speak to us, whether that's just speaking to our client advisors and having a one-off conversation, or whether it's actually booking a meeting and discussing things in a bit more detail. That way we know that that person's receiving the right care from the right organisation. We want to work together very cohesively across the Wakefield district to make sure people receive the right care and that their mental health journey goes very well and recovery does happen for them.